Welcome to Post-Operative Pain Assessment and Management. This continues to remain an unsolved problem amongst nursing clinicians alike, with a staggering 29.7% of post-operative patients scoring moderate to severe pain with the current intervention of a visual analog pain scale and a combination of analgesic pain methods such as patient-controlled analgesia, epidurals, continuous spinal effusions, and nerve blockers. We have to wonder where we're going wrong in terms of managing post-operative pain. A leading concern is that untreated acute postoperative pain can be a contributing factor for the development of chronic pain. The current burden on the health system stands at $34.3 billion and rising. Pain management can be difficult with your average patient, however, it seems to affect certain cohorts more than others. Those that are culturally and linguistically different, neonates, and young children who can't communicate their pain levels. Similarly, the elder patients suffering from cognitive impairment, and it is important for nurses to spend extra time communicating, whether it through interpreters or other family members, and assessment tools such as the Baker-Wong pain scale. Barriers to post-operative pain management come down to three things. Patients seem to be worried about bothering nurses for pain relief, being reluctant to take the pain relief because of the side effects. Barriers to nursing seem to follow that in the same direction, with a lack of knowledge of pain management and also a fear of side effects of the analgesia. The third barrier lies within the hospital policies, such as a lack of proper pain assessment tools, a lack of understanding of current policies and rules of the hospital, and issues regarding implementing research to practice. Here it seems to be the root of the problem, increasing education and pain management of the side effects to clinicians so they can help re-educate their patients to make informed decisions about pain relief available, as well as taking the time to be available for your patients by implementing hourly rounding whilst incorporating individualized pain plans depending on the procedure-specific analgesia guidelines or prospect. Nurses need to work with the continuing goal of correct documentation and ISBA handover to cover the patient care. It is important to follow the guidelines of best practice set up by the Australian Pain Society and the Australian and New Zealand College of Anaesthetists, whilst researchers work together to create the highest level of evidential research to implement practice. Best practice for postoperative pain and management, according to the guidelines set by the Australian and New Zealand College of Anaesthetists, show that education in terms of acute pain management should be supported for all medical staff, as well as stating that nurses have a key role in keeping on with outgoing education. The guidelines show that individual pain management, as well as proper pain assessment and frequent observations to reassess the pain intensity, along with effect of intervention given. In terms of pharmacological therapies, the multimodal analgesia improves the acute postoperative pain, and the anchor also state that patient-controlled analgesia, epidural, and other regional analgesic procedures best practice, as well as the continuous infusion of opioids and local anesthetics to be used as an adjunctive therapy. ANZIG also believes in multidisciplinary approach of pain management, such as the inclusion of acute pain team or acute pain nurse to improve patient outcomes. Dolan, Cashman and Bland's 2002 meta-analysis of the key international and Australian national studies found that postoperative pain continues to be a major problem. 165 studies showed more than 29.7% of surgical patients experienced severe pain causing severe distress. In Australia, these findings have sparked far higher education in clinical management of pain, and the Australian Pain Society and Australian and New Zealand College of Anaesthetists have worked together to develop a best practice approach to pain management, naming pain the fifth vital sign. The most prevalent and existing challenge to implementing research is the trustworthiness of the research to encourage bench to practice. The research of more than 800 primary studies showed that despite lots of evidence, there were barriers to implementing the research to practice and creating the guidelines. This is due to a lack of high-level reliable resources, leading to a lack of trustworthiness in the study. This specific report shows a lack of high-level evidence and barriers to research to practice with regards to optimal methods and timing of perioperative patient education, combination of analgesic techniques, and a lack of monitoring patients' response to treatment. From documentation to the problem, controlling postoperative pain, looks at the problem of inadequate pain control even when standards are in place. NARA also looks at pain as the fifth vital sign and researches reasons of its ineffectiveness to keep pain controlled. NARA notes that her findings can make several recommendations to improve the PRN medication chart and continued education for clinicians is imperative to improve effectiveness on pain levels. She calls for a refocus on pain control and correct pain documentation as the fifth vital sign throughout the SAGO chart. Another challenge facing the nursing team is to decrease post-operative pain, which is noted in the research, which has found that nurses have difficulty remaining subjective about their patients' pain, and these behaviors can hinder effective pain management, as nurses base their pain management on their own experiences and perceptions. Lee, Sheng, Joshi, and Klett's 2018 study on postoperative pain management recognizes the challenges of implementing research findings to practice, and to have started using evidence-based practice to initiate prospect or procedure-specific pain management. This tool allows the use of evidence-based recommendations to prevent and treat pain pre- and postoperatively. Through studies, Prospect has shown the efficacy of the analgesia differs from procedure to procedure, and thus not all pain should be treated the same. Prospect evidence shows that current postoperative pain management is not meeting the benchmark. Its main recommendation was multimodal analgesia, such as adjuncts, as well as individualized procedure-specific pain management. Prospect simply shows the most effective evidence-based analgesic interventions for each stage of the surgical process. Nurses are at the forefront of pain management using the tools given to them for effective pain management. However, this continues to be a problem and has solutions such as the individualized procedure-specific pain plans, which help to develop critical thinking in terms of selecting the right opioid and analgesic combinations for effective pain relief, increasing compliance of the SAGO chart, and completing the pain scores and documenting the PRN chart correctly. Having an increase of awareness of hospital policies for pain assessment tools can help nurses remain objective and deliver more effective pain management. The implementation of an acute pain team or acute pain nurse to add higher levels of investigation into pain, as well as having a specialized resource available for any concerns. These solutions will have a knock-on effect of decreasing postoperative pain and increasing positive patient outcomes. The decrease of acute pain persistence can reduce the risk of chronic pain developing. The barriers and solutions identified need careful consideration to create positive future changes to postoperative nursing practice. Postoperative pain needs to be reduced drastically, with 29.7% of postoperative patients scoring moderate to severe pain. If correct changes are implemented, this statistic should reduce and create a more positive outlook on surgery, as well as to reduce distress amongst patients.